Hi everyone, my name is Alia and I'm a GP in Melbourne. It's Wednesday, March 25th, and a novel human coronavirus, Covid-19, is causing a pandemic worldwide. People are panicking and fear is rising. But we must not panic. We must be prepared, be kind, rational and sensible. But we must act now. I want to send a message to the Australian community that there is something each of us can do to make a massive impact on the course of Covid-19. As of 3 p.m. on the 24th of March 2020, there have been 2,124 confirmed cases of Covid-19 in Australia. There have been 427 new cases since 3 p.m. yesterday. The number of new cases are doubling every 2 to 3 days. Deaths in Italy have surpassed China's total, where 50% seem to make it through, but 50% seem to be ending up with severe pneumonia and dying. This is not an old person's disease. 20 to 30% of the ICU beds in Italy are occupied by healthy, under 65-year-olds with no known risk factors, and we don't know why. Our curve is rising at the same rate as Italy's. Australia has not flattened the curve. Each of us, you and I, must act now. We must not wait for the government to tell us what to do. This is an emergency and getting it perfect is not the priority right now. Speed is. Everyone's afraid of the consequence of error and making mistakes. But really the greatest error we could make is not to move. To be paralysed by the fear of failure. We can't be perfectionists right now. We just don't have time. Social distancing does work, but only if everyone does it. So we all need to do our bit. It means we can't go away on weekends with our mates for now or throw massive parties on the beach. The decision to close schools early in Victoria was a smart one. And let me point out, our own Prime Minister has had his own children out of school for some weeks now and has failed to give a valid explanation as to why. Our staggered approach isn't working. It's allowing this virus to escalate to a point that will see each of us knowing at least one person that will end up in hospital or dying from this disease. So let me start with the simple stuff. Social distancing or healthy spacing or physical distancing, whatever you want to call it. I understand the message from the government has been very mixed and confusing. On the one hand, we're being told to stay at home, but workplaces and schools have stayed open. I also realise this behaviour is not normal for us. It's difficult. We're social creatures. We feel disconnected and we feel a sense of loss about missing out on social gatherings, key milestones, birthdays, family events, and time with our friends. But people can be walking around with no symptoms and still be infectious, which is why this is so hard to control. And why this is the one measure that is the most effective thing that we can do right now to slow the spread. Australia has banned gatherings of more than 500 people or 100 indoors. In other countries, it's 250, others 100. The CDC said 50, Trump said 10, and Germany have said 2. Smart. The correct number for effective social isolation or social distancing is one person or the smallest number of people in a family or in a single home. We really must take a very strict version of social distancing and interpersonal space right now. So please don't leave your house unless it's absolutely necessary. Don't touch anything outside your home unless it's absolutely necessary. Don't touch people if you can avoid it. We can't be shaking hands and hugging right now, and I know it feels strange, but we need to avoid that as well. Cancel everything involving 2 or more people unless you really, really have to do it. Parents, if you're able to keep your children at home without affecting the work of a parent in an important service, like a nurse, doctor, or emergency services, please do so. Please keep you and your family safe. Employers, please let your staff work from home. Bottom line, stay home and stay away from others wherever possible. It's a really tough time. It feels strange and isolating, and it's not the way we're used to behaving. It will take some adjustment. It's particularly important for us to maintain verbal, written, and electronic contact to stay connected, but just be cautious about the physical contact, particularly with people who are at high risk, such as the elderly, people with heart problems, lung problems, diabetes, high blood pressure, cancer patients, and we need to be cautious around pregnant women, immunosuppressed people, and Aboriginal and Torres Strait Island peoples. Wash your hands. Even though you might think you're washing your hands a lot, do it more. Cough into your elbow. Try to keep your hands below your shoulders and try not to touch your mouth, eyes, or nose. Clean surfaces regularly, especially your handheld devices. Masks. Masks are for sick people or healthcare workers. The virus is not airborne. It spreads through aerosol droplets when someone coughs or sneezes onto a surface that you then touch. We as medical professionals, we want to keep looking after you, but we need to stay protected in order to do so. If you were a smoker, there was never a better time to quit smoking than now. I'm going to clarify now the difference between quarantine, self-isolation, and isolation. So quarantine means you are at risk of having COVID-19 infection, such as in a returned traveller, but you're not actually known to be infected or have any symptoms. So you may end up with it and you may not. But as the virus is increasing in the community, so it's not just coming now from overseas travellers, it is very, very important that anyone who is unwell with a cold, cough, or flu-like symptoms should go into quarantine until they are well again. So please don't go outside and spread your germs. If you've come back from overseas or you've had close contact with someone who is positive, you need to wait it out in quarantine. Stay at home until the 14 days have passed. If you're awaiting a test result for COVID-19, we ask you to wait in quarantine until you have your result. Close contact, to clarify, means 15 minutes face-to-face or 2 hours in a room with someone who was COVID positive in the 24 hours before you became unwell. Self-isolation, this means you're COVID-19 positive. You are well enough to be looked after at home. Your family, housemates, friends, and work colleagues will need to be in quarantine if they have had close contact with you. Isolation means you are COVID-19 positive, but you're not well enough to be looked after at home. So you're in a hospital, and then you may become well enough to be sent home, and you can then complete self-isolation at home. Now, a lot of people are wondering about COVID-19 versus influenza and if they're basically the same thing. The simple answer is no, they are not. Both viruses are transmitted in the same way via aerosol droplets, so coughing or sneezing onto a surface. So good hand hygiene and proper respiratory etiquette, so sneezing into your elbow or coughing into your elbow is really important. But coronavirus differs from influenza in a few key areas. So it seems to affect you more the older you are and the more problems that you have. But it is, as I said, affecting lots of young, healthy adults too, and we don't know why. It does affect babies more in the first year of life. We know that COVID-19 is about twice as contagious as influenza. And when we talk about fatality, that's how deadly it is, we know influenza kills about 290,000 to 650,000 people globally every year. And we know that COVID-19 is somewhere between 10 to 30 times more fatal, more deadly. Now I want to speak to the community because the medical frontline really needs your help and consideration. As we brace for this impact, we need to assume a safety position. So please don't book a medical appointment for a medical certificate with your GP. GPs and EDs are super busy right now and we will only get busier. Please don't book for assurance. We can't test everyone. At this time, we simply don't have enough testing kits and we don't have enough protective masks. We want to stay safe so that we can keep looking after you and your loved ones if they get sick, whether it be from coronavirus or something else. So this brings me to the topic of shutdowns and why they're important and what the thinking is behind them. So in the absence of being able to test everyone and mass testing and a graph that's rising very steeply, with cases doubling every 2 to 3 days, the longer we wait, the more cases we've got. And we are losing control of this situation. We have to be prudent and shut things down to gain some control of the situation. If we don't, people will die. Older people, but also younger people. On top of this, the medical frontline, your doctors and nurses who are in this war zone are running out of protective masks, gowns, gloves, and eye protection. They're exposed, some are becoming critically unwell, and some are dying. So to those young people who are out partying at Bondi, or those deciding to maybe have their last hurrah, I want to ask you, do you know someone older than 65, or someone with asthma, or a doctor or a nurse? You are risking their lives. You probably think if you get it, it's no big deal and you'll be okay. And you're probably right. But you might rock up to ED or your GP, or go out into the community and expose your disease to others, to health staff, and they may get sick and they may die. Are you willing to live with that? Let's get some perspective on the numbers. We're estimating 20% of our population will get infected. 5% will end up critically unwell in ICU. There's 25 million Australians, so 5 million will get infected and 80,000 will need ICU. In Australia, we have 2,000 ICU beds. Our hospitals will be full. ED will be full and the wards will be full. So ask yourself what you will do if you have a car accident or break your ankle, or your mother or father is unwell with coronavirus, or unwell from something else, or your child becomes sick. They will not be able to be treated. Our ancestors lived through wars and famine. During these times, no one took a staggered approach or worried about the economy taking a hit. They took leadership and they fought together to survive. These are tough and unprecedented times. I know this is hard. I'm a very social creature myself, and I feel like I'm giving up my social freedoms and I'm giving up my luxuries. The health and well-being of our population has to come first. A wartime effort will now be required to avoid a catastrophic health disaster. This may go down in history as the Great Covid-19 War. Your grandchild will come along and say, "What did you do during the Great COVID War?" And you can say, "I did social distancing. I cut holidays. I gave up my social freedoms." And they will say, "Thank you. You contributed and you fought to save our lives." This is our war. We need to fight it together.